Okay, so now it is March 18th, and I am getting talked about dialysis, the procedures that I need to get done to get dialyzed. First thing they did do is put a portacath. It's a catheter that is inserted into your chest with a line that goes up to your neck and downward towards your heart. That way, they get the freshest blood, apparently, to clean your system from toxins and other bacteria that are produced that are supposed to be filtered from your kidney but are no longer filtered once your kidneys no longer work. The other option afterwards, for long-term dialysis, is the AV fistula, which I showed earlier. It's a surgery on your wrist or on your bicep. Size of the needles range between 14 to 15 gauge needles. It's the most effective way to dialyze you because the flow of blood that comes out is the quickest. With a catheter, it's not that great. You can clog up the machine. Anyone who is on dialysis or is going to be, and you have a catheter and you don't want to get the surgery on your hand, I suggest you get the AV fistula unless you're going to be getting a transplant soon, because the portacath is not meant to last a long time. And it has a lot of complications. Because of the catheter in my chest, it almost cost me my life plenty of times. From March 18th, that was my first day on dialysis, till about, I want to say October or September, was one of the last times that they used my catheter. The catheter alone produces complications. It is meant to be temporary, and it can easily become infected. You should actually not shower. You have to bathe so that water doesn't go in there, because it's technically a wound and you can't get bacteria in there, which, trust me, that happened to me. So from March till, let's say, October, I was in and out of the emergency room all the time. It was so bad that if I didn't show up to dialysis, they would just call the hospital to make sure that I checked myself in, because most likely I was already there. And it was never like a in and out kind of thing. I would stay there for a week. Sometimes it was very serious. I caught a staph infection on the catheter because I got caught in a severe thunderstorm. It got wet. Another thing that happened is I ended up catching an infection that gave me a fever. I remember checking into the hospital at a fever of 101.2. That was on a Monday. The next thing I know, it was Friday afternoon, and I don't remember being there from Monday to Friday. They said that my fever went up to 104.9, to the point where I was sitting in my room talking to myself, delusional apparently, and it was very dangerous for a kidney patient to have a fever like that. Yeah, it was pretty bad. I don't remember it, but my doctors and some of my family members did tell me that I was out of it for a couple of days. Another thing that happened is the catheter twice almost fell out of my chest. One of them, it got infected to the point where my chest was swollen, and that's where I caught staph. And it was very serious to get that treated. So I had a lot of close calls with the catheter and being very seriously ill in the hospital. So I really suggest that if you're gonna go under dialysis and you don't want to get the scar on your hand, it's a lot better to have a scar on your hand than to constantly be replacing a catheter that is not cleaning your body properly. The fistula will actually clean your blood properly, so you feel a lot better, less tired after treatment. I used to suffer a lot from low blood pressure after dialysis. So I'll explain the process of dialysis. So the blood is taken out. It goes through a filtration machine of the dialysis, and they determine how much weight they're going to take off you between kilos, like I stated. Now, during this process, you are laying down or sitting down on a chair. Your body's not moving, you're not active, but your heart is pumping really hard because a lot of blood is coming out. So it's like you're sitting there, but you're running a marathon for 3 to 4 hours. So by the time they unplug you and your blood flow goes back to normal, your heart is still racing and your body is tired. And one of the biggest factors that some patients may have is that your blood pressure may drop. You might stand up, and this happened to me plenty of times at my dialysis center. It happened plenty of times at my house where I was so tired that I would just faint. I would completely collapse. With the only thing you can tell is your face gets hot, and before you know it, you're on the floor. It sucks, but it's just part of life once you get to that point. So the other thing is dry weight. Some of you will know what dry weight is. Dry weight is what your weight is with the fluids taken out properly. How do you know if they've taken out too much weight? You know because you start suffering from pains and cramps on your stomach. Severe cramps. I mean, these are not regular cramps. It's a really strong cramp, and it becomes very hard to breathe during treatment. By that point, that means that you already reached your dry weight, and if they pull any more, you're not going to be feeling good at all, and you're probably not going to be able to get up. So they have to put some more in you and then determine whatever your new dry weight is, because being on dialysis, you do start losing weight fast. So whatever your weight is in the beginning, it's going to change to something lower. Particularly if you're working out or exercising, then you should really constantly be changing your dry weight to adjust to whatever improvements you're doing to yourself health-wise. So, like I was saying, the feeling, it doesn't feel like anything to be dialyzed except afterwards. The tiredness, the fatigue, you're just so tired. All you really want to do is lay down. Sometimes eat. I used to eat something salty to kind of help with my blood pressure. The other thing about being on dialysis on a constant basis, I mean, you try to be optimistic about everything's going to be okay or you're going to get past this, but when you start to sit there and realize that your life depends on a machine now and that you can no longer consume water, something that a lot of people just, obviously take for granted because they have perfectly working kidneys. Yeah, I'm a little jealous, but you start taking a lot of things in consideration. After being on dialysis for under a year, most likely you're not going to produce any more urine, and your water intake has to be very minimal. Not only that, but there's a lot of food restrictions. I was restricted from milk because you can get something called calcification, where you start getting black spots in your body, face, and that's from high levels of calcium, from phosphorus. Phosphorus is another word that you will discover that is in a lot of foods. So a lot of rules to follow, and you start feeling not so happy about having to do this every other day. And particularly with me, it got in the way of my life because I just turned 21. I was ready to finally go back to school and start college. At that time I wanted to go to criminal justice, but then I got sick. And my life completely shut down on me. From the complications of me constantly being in the hospital, I had to stop working and get used to being in the ER constantly and getting treatments done and being sick. And you become very accustomed to being nauseous, to fainting, low blood pressure, to not being in the mood to do anything. Another thing is that you start changing personally. I believe they gave me a pamphlet when I started, and one of the effects of being on dialysis is that you do become very depressed. Very depressed. I mean, it's depressing. Particularly when you're young and you walk into a clinic and you realize that you're the youngest person in there. You start to wonder, what is it that you did that you had to be here? Or where is this going to lead you? How much pain do you have to endure? Hopefully whoever is enduring this kind of stuff has a family to support them. The only family that I have were my parents and my brothers. I don't have cousins or uncles or anything like that ever went to visit me in the hospital. I never had any sort of support like that. Now, as far as me going to the hospital every time it was an emergency thing, I always went alone. I wanted to deal with the reality that it could be my last day on by myself, because to me, my situation was already depressing enough with being on dialysis that I really didn't want to be in an emergency room with my family, particularly my mom or other relatives or family members, there crying or feeling bad for me. I'd rather just take it solo and let life be. So, kidney dialysis is just a treatment. It is not something long term. Neither is a transplant. There is no cure for kidney disease. A transplant is considered a treatment as well, because since it's not part of your body, you have to take immune suppressants to stop your body from fighting the transplant. So just like dialysis, there is a life expectancy of what they expect you to live from being on dialysis. And being on dialysis long term has negative effects on your body, such as your heart, because your heart is constantly being worked 3 times a week vigorously, and your heart starts getting tired. When I was 22, I got a stress test at the hospital, and they told me I had the heart of a 63-year-old from being on dialysis. That's not the best thing to hear when you're that young. You start feeling a little hopeless and feeling like you're gonna be stuck in this situation till it kills you. I waited. I was on dialysis for about 2 years and 8 months. Towards the end of dialysis, my body was reacting very bad to it. I had a lot of calcification going on in my face. My legs would start cramping immediately during treatment. I couldn't fall asleep. I couldn't rest. I honestly was just ready to kind of give up, because I felt very hopeless at that time, and dialysis was just an agony to me, to not be able to sit there and rest. I constantly had to get up because I would get Charlie horses, or I would feel too fatigued. At home, I would constantly be blacking out. It was terrible. And not only that, but you also start suffering a lot from a lot of vomiting. Nausea literally can become your best friend, and you will throw up a lot. And it's not fun, but it's something you have to become accustomed to. I'm sure I'm not the only one who went through that. Like I said, I'm just here to share my story and see if anybody else can relate or has gone through the same things that I have. So usually after dialysis, you kind of do that in 3 times a week, whatever your schedule is. From being on dialysis, another thing that does happen that you have to be very realistic is that some of the patients that you might go there, who you befriend, might not be there the next day. During my 2 years and 8 months that I was on dialysis, I lost one particular friend of mine passed away in a really tragic accident 2 days before my transplant. And he died, and he was the person that I promised that I was going to go and visit them after my transplant. I used to call him Boss Man. He was a big guy. He passed away right before my transplant, and I was not able to see him. I didn't find out how he passed away until the day before I had to go to Chicago to get my transplant done, and everybody at the clinic was very depressed about that, because it is very hard to see one of your fellow dialysis friends go, because we all understand how hard it is mentally, emotionally, physically, and it's just a hard process. And you kind of sit there and think, when is it going to be my turn? Because it can be. You could be driving home one day and your blood pressure drops. You can be in a serious car accident and die.